America is well underway with the Affordable Care Act, known as Obamacare. Apparently, there are many issues of great concerns since its implementation for what was supposed to be a saving grace for those who need affordable health care and as yet haven't gotten it. There are obvious problems with this 36-inch tall bill passed by Congress. My guest today is considered an expert on the Affordable Care Act. He'll tell us what is missing, what has failed us, and what might have been good intentions gone wild. He is Dr. John Hassett. Welcome, Dr. Hassett.
Thank you very much, Chris.
Now, since you were here last time, we went over some basics about it.
Yeah.
Where do you want to start about going forward and begin?
Well, probably one of the best questions is the passage of it, which is rather interesting. HR 3390. Most people probably have never even heard of that. I mean, have you ever heard of HR 3390? We actually have. It was the first time homeowners Veterans Tax Act. And that was passed unanimously in the House, introduced by Charlie Rangel. Well, that was actually winds up becoming the Affordable Care Act. And that's what people don't actually realize. When you originally went to the Library of Congress website to download it, which is what I did, you download it, you read it, the whole bit. You look at it, and it took me about 8 months to read. 6 months, and I had to give a talk about it, so I read about 3/4 of it in 6 months. And then I kind of got sick and tired of it. I said, I got to put this down. This is crazy. And somebody wanted to give me a talk about it. I said, I can't say I read most of it. I read some of it, so I have to finish reading it. So I took another 2 months and finished reading it. But the way it was originally passed was they had passed a health care law, not this law, but they'd passed a health care bill in the House. And it got passed by the House under a lot of arguments. This was in early 2009. And then went to the Senate and failed. And then the Senate introduced the Affordable Care Act, and it passed the Senate, and then Nancy Pelosi said, oh, that's close enough to something else we passed, and deemed it to pass on Christmas Eve. And her famous quote of, it'll be like a Christmas present. You have to wait to find out what's in it once you open it, or once you vote on it, in this case. So then that got passed via that means, which isn't technically passed, but that's a whole different story. And then there was an amendment that was added on later on in March, which did some other firming up to things. But the Library of Congress website, if you go to the Library of Congress and look it up, it says it was not introduced by Charles Schumer in the Senate and passed in the Senate and then went to the House and passed by reconciliation. You have to dig through hyperlinks to find that truth. Initially, when you go to the Library of Congress, it says it was HR 3390 was introduced by Charlie Rangel in the House, passed 100% unanimously, 100% support in the House, went to the Senate, was passed and signed into law. And then it talks about March. But if you dig through the hyperlinks, you find the truth. So what was originally HR 3390 was the First-Time Veterans Homeownership Tax Act, which was designed to give first-time veterans from Iraq and Afghanistan that wanted to buy a house for the first time a tax credit. Well,
that's what that was about?
That's what it was originally. The original bill was, and it was passed unanimously in the House. Nothing about health care, nothing about anything along those lines, just about giving veterans, our men and women that returned back from overseas, that served in the military, a break at buying a house. And the title and all the contents of the bill were removed by Charlie Schumer, and then the Affordable Care Act was shoved in its place. And that's how they were then able to turn around and say, well, look, it already passed the House, and Nancy Pelosi said, that's close enough, which obviously is not close enough.
A big bill like that into a small little bill.
Correct.
It's just jammed
in. But it's interesting that the Library of Congress actually quotes it as being that. So if you were a student doing an initial search, or even some reporters doing an initial search, you might go, well, I went to the Library of Congress, and this is what it says. But if you don't bother digging through several layers of hyperlinks, you don't actually, and you weren't alive or paying attention at the time, depending upon the age at which you are when you go to the Library of Congress, you might not know the truth, and you might be deceived by just first pass viewing of them. But more to the point, the HR 3390, or the Affordable Care Act, is designed to have the U.S. Preventative Task Force, which has been in existence for a long time, which is designed to look at preventing diseases. That task force is designed to look at different studies that have been done by doctors across the world, across the country and across the world, and then decide what's important to do, what's not important to do, how to pass them, what tests should be appropriate, what tests aren't necessarily that needed. So when it came out a few years ago, when the USPTF decided oh, women over a certain age or under a certain age don't need mammograms, so don't need mammograms that often. And they come out with those recommendations. There's a big uproar about, what are you talking about?
Yeah, I remember.
And then they backed off on that. But that was the USPTF that decided that. Same organization said, well, there's not that much of a need for PSAs and maybe we should do away with them altogether. That's the USPTF. The IPAB, which is also referenced in there, is the Independent Payment Advisory Board. That wasn't established with the Affordable Care Act, but was established in, I think it was Stimulus 1 or Stimulus 2, and passed in 2009 for, to help boost the economy and get us out of the recession. The Independent Payment Advisory Board hasn't even been appointed yet. So nobody has been appointed to that board. Well, the law says that, or the Affordable Care Act says, that literally, if there's nobody there, then it defers to the Secretary of Health and Human Services.
What does, exactly?
Medical decision making
Okay.
for medical decisions.
Okay.
So the Independent Payment Advisory Board is referenced in the Affordable Care Act to say, you'll come out with the recommendations to say, this should be approved, this shouldn't be approved, this should be done, this shouldn't be done. But it says that then what happens is the board comes up with these recommendations. It goes before a House Congressional Subcommittee, if I remember right. And then those recommendations then go to the Secretary of Health and Human Services, who then decides, yeah, I'll take those recommendations, or no, I won't.
Seems like a lot of chains in this link.
There are a lot of
links in-
chains, but basically where the buck stops is with the Secretary for Health and Human Services, which is why back in 2010 and then into 2012 the case continued on of the young girl, and it was made a little bit of news. Probably should have made a lot more news because it was what was to come, but it was an election year, of the young girl in Pennsylvania who had cystic fibrosis. And she was told, rightfully so, she needed a double lung transplant. And the doctors at the hospital said, hey, she needs to be put on the adult transplant list because she's tall enough, she's big enough that she could do with an adult lung and this would work. So she could get both bad lungs removed, at least have one good lung put in place. And she should be put on the adult transplant list. Kathleen Sebelius, the Secretary of Health and Human Services, said no. Her rationale was she may never become productive enough for society, i.e. why waste the money on her? Now, her father sued. The Affordable Care Act says the Secretary of Health and Human Services has the authority to do this. The father sued. The administration didn't really fight that hard, and I think because it was an election year, but I don't know their mind, why they didn't fight that hard. And the judge said, no, you have to go ahead and put her on the adult transplant list. And she was put on the adult transplant list. She did get a lung, and she wound up getting a second lung later on as well.
Good for her.
But that was a case where this was already being used. I'm hearing from patients.
It showed up.
It showed up of,
Yeah.
Case in point, easily
This is it,
verifiable.
yeah.
You can look it up, you can research the case.
Here we go.
And you can find it. I've been told by patients, a woman that told me that when I give talks about the Affordable Care Act, she came up to me after, she said, yeah, I was told I was now too old to get a kidney transplant. I was taken off the kidney transplant list. I was told by another man that said that his wife was told she was too old for dialysis and was taken off that. A woman who said her husband was too old for chemotherapy. So you're starting to get this to pop up more and more. Now, I had talked previously about Dr. Ezekiel Emanuel's complete live system and how age should be used instead of traditionally the doctor making the medical decision making with the patient and the family. That age should be used by a criteria, and the government should decide that, or a government intermediary, either one of the two he was okay with, should decide basically who gets health care and who doesn't, or what comes down to who lives and who dies. And the complete live system is easily something to look up as well. He wrote a very nice article about it. In the article, he talks about the detractions that some people may say this is ageism. You're killing off elderly people. His argument was people between the ages of 15 and 40 are the most productive to society, and therefore should get the most amount of health care.
Sounds like social.
Yeah, but under 15 and over 40, they're less productive to society, and they therefore should get less and maybe none at all. Because the under 15 may never become productive enough to society, and the over 40, they've already done the most they could for society, and the older they get, the less they'll be able to produce
Those
for
are
society.
socialism type.
Yeah, that's a socialist.
Doctrines,
It's a socialist philosophy.
Yeah.
Whether it be a national socialist philosophy or a state socialist philosophy, whether you look at a communist, fascist, whatever you want to consider it. But national socialists or state socialists believe in the same idea that the state decides everything. So people, whether they be conservative or liberal or Democrat or Republican, all people, I think all Americans, or most Americans, I should say, most Americans, I believe, in freedom. And at least the freedom to choose
the
what you
ability
want to
to
do.
choose the way to remedy your issue.
Correct. And this law takes a lot of that choice and a lot of that freedom
Throws it right out.
of the equation. Now telling you have to do certain things, or you won't be allowed to do certain things, or we're not going to do certain things for you, and you won't have the option. Now, if you're very wealthy and you can afford for a kidney transplant or hip replacement or dialysis, and you can pay it out of pocket yourself, God bless you. You know, you did great. But
Right.
at the same time, you've also now further diversified the society from a very rich to then everyone
You
else.
created a class almost.
You've created now a class separation and destroyed the middle class in the process.
Right.
Because most middle class won't be able to afford it, and poor people won't be able to afford it. That's for darn sure. And only leaving the upper class that'll be able to afford things.
And the intention of the Affordable Care Act was to develop a healthcare system that would allow the people who can't afford coverage.
Correct.
And so it defeats that.
Correct. It does the exact opposite.
Right.
And that's part of the big problem with it, is because even if the intention was good, there's a famous saying, the road to hell is paved with good intentions. And it's this famous saying because sometimes you can have a good intention, but if you don't follow through the thought process and think of how it's going to affect people, and then what's going to happen, those choices and freedoms that we hold so dear are literally taken away from us. So if you believe in, you know, whether you believe in medical marijuana use, or you believe in abortions, or you believe in whatever, you have different options and choices. In my opinion, options and choices end where, or as somebody put it, my freedom ends with my fist where your face begins. So once you take a freedom and a choice away from someone and you put it in the hands of the government, you say, it's no longer your option, it's no longer your choice.
So that was what always was American to me, opportunity and choice.
Correct. And that's not something that's handled anymore. Now, abortion's a whole different topic, which we're not for today, because you talk about whether or not the fetus or the unborn child has options and choices as well, which potentially is an issue, which I'm along the pro-life standpoint.
Yeah, I'm on the place where the minute that the zygote is created, we're in.
Well,
When Susan starts to develop on its own.
I have the same mindset. But
Yeah.
as an American, I understand that not everyone necessarily believes as I do. So at the very least, you should be able to get people to agree that, hey, look, once you have neurologic activity, the Supreme Court's decided that the brain death is cessation of life. Why can't you at least agree? Why can't we all at least agree that initiation of brain activity is life?
Sure.
So I mean, I agree it begins with conception, but at the very least, pull back this whole late-term abortion stuff and the which has been in the news recently about Planned Parenthood selling off organs because, hey, why not?
Is that unbelievable? I mean, that's a new lower threshold.
It is, but it goes against the Hippocratic Oath. And because you're now destroying life, and you're not only destroying life, but now you're harvesting life for death.
You know, you would dream up this in a movie, wouldn't you? I mean, if you were trying to create a science fiction movie, this could be a, you know.
Absolutely. In fact, I think the Outer Limits even did something similar to it.
That's
at one
right. It
point
sounds
in time.
familiar to me.
The newer Outer Limits, not the older ones. But yeah, it's. I mean, as we get very far off topic, though, it's one of choices and freedoms of decision making for healthcare. So if I'm 90 years old and I want to decide that, hey, I do want to pay out of pocket for X, Y, Z, okay, great. If I'm 70 years old and I want to pay and I want a procedure, I want the bypass surgery. 70 isn't that old anymore these days. You have people that are still working at 70 years old.
People expect to live over 100 now more often.
Correct.
Our age is going up.
So, you know, if you want to have a CABG, or open heart surgery, or you want to have coronary stents put in, and your father or your grandfather, or depending upon your age, or your spouse, turns around and says, you know, look, you have angina, that's unstable angina, and you need a coronary angiogram. Literally, I was told a story last night about a man that was told, look, you know what, it's been decided you're too old for that. Personally, I would change your symptoms and then go into an emergency room and say that you have these symptoms instead, because you're not going to get what you need done. And sure enough, he did, and he wound up needing 3 stents. So,
you know, over time, you know, as these things that were created by socialism thought years ago, that was a long time ago, and that age differentiation was less. The threshold was less. Now we're living longer, so now it doesn't apply So if you're using today's standard by determining what this Affordable Care Act is going to do,
Right.
it doesn't even come out in the wash. It's not even practical anymore.
Correct. And essentially, Dr. Emanuel's argument was that once you move to that system, and he's one of the White House advisors on healthcare, one of the authors of the healthcare law, the Affordable Care Act, is that he literally said the biggest hurdle we're going to have is the Hippocratic Oath. We need to get doctors to ignore what's good for their patients and do what's good for society. So his idea of collectivism, of putting society before the individual, forgetting that society is made up of individuals. And once you unhinge from the Hippocratic Oath, it can get very, very dark,
Very murky.
as it did during the middle of the 20th century, in the early parts of the 20th century in Germany. Things like that occur once you start to put the society needs before the individual.
Right.
As opposed to saying the individual is important, individual life is important.
That's how we succeeded so often where other societies failed.
Correct. And whether you look at the fascists or you look at communists, their economic and policies that created the Holodomor, for example, in the Ukraine, or whether you look at what happened in Germany as well with the Holocaust. There are different ways that policies then wind up becoming distorted to evil.
Can we talk for a minute about the Scandinavian, the narrowness
yeah.
that we talked about before? Because to me that means a lot to me.
So, moving along the bad parts of the plan is, one of the arguments in favor of the Affordable Care Act is that, look, you have Scandinavian countries that say, we have socialized medicine, we've cut down costs, we've managed to curb the rising cost of healthcare, which was one of the arguments as well, and we can provide healthcare for everyone. Well, they have a few things that we don't have. One is physician-assisted suicide at any age is approved. They also have, as well, the fact you have a very narrow genome. So if you have a Scandinavian country where almost everyone is related from several different families and very narrow genetic spectrum.
The average height is about the same, the body weight's about the same, color hair, there's a lot of things that biologically they're similar.
That are similar, correct.
Yeah.
So if you have a lot of similarities genetically, then if you say, look, we need a pill for cholesterol to help lower cholesterol, you pick one of the pills, it works for some of your people in your population, it's probably going to work for almost everyone in your population, with very few exceptions. You'll be able to save costs by making sure it's only one cholesterol pill or one blood pressure pill. And maybe there are diseases that nobody in your country gets. You don't even need medication for that because it's going to be so rare that it happen.
Right, okay.
The United States of America, however, if you wanted to take that model and then translate it over here, we have such a broad genetic spectrum, thankfully.
Yeah.
We have people from American Indians to Eskimos to Tibetans
it could never
to
be,
Japanese
it really
to
can't
Chinese.
be equated, right?
Right.
It can't be
people
equated
from
the same way.
continents and all four corners of the globe. We have such wonderful diversity in this country that shouldn't we embrace diversity of thought?
Absolutely.
And to be able to say, hey, look, all opinions are relevant, all possibilities are relevant, and looking at the diversity of thought, which is sometimes gets lost in, hey, you have to do it the way the government wants you to do it now.
I missed this in my discussions with so many people, so I'm glad you had a chance to mention it because it's very critical. They always use the Scandinavian example.
Yeah, and it's a wonderful example, but if it's a very narrow genetic spectrum and you have...
Probability is much higher.
It's easier to handle things. But they look at Dr. Emanuel at least looks at it from the viewpoint of, look, this is a mathematical equation, and we know that we need to curb costs somehow because eventually it'll be unsustainable. But we've talked a lot about that. I mean, you might have some more questions, but what's even better?
Yeah, I want you to stay with it. We got about 10 minutes left, so go ahead.
Okay, so what do you do to replace it? So I talked a lot about detractions and the evils, potential evils, all the things that are occurring that aren't good. The fact that doctors can't start hospitals anymore, which is actually in the Affordable Care Act, because possibly doctors would actually, they can no longer start hospitals or own pieces of hospitals as part of the Affordable Care Act. But if enough doctors caught on and actually read the law, they'd say, well, this is crazy, let's start our own. So you can't do that now by federal law. So where do we go from here, though? If we repealed the Affordable Care Act and said, look, we're going to get rid of this, what are we doing instead? Well, you could allow people the option to have the older system of Medicare and Medicaid. They could be on those systems if they're too poor or they're disabled or they're elderly. They would fit on those systems the way that they existed.
Can you choose those still? You can still choose those options still?
You can, but I mean the more traditional approach where the Secretary of Health and Human Services doesn't decide who gets what.
Okay.
And what procedures are authorized and what procedures aren't authorized.
Okay, so it's a little freedom back into the...
Put the freedom back into the equation of the system.
Gotcha.
But then also give people the option to choose, like Dr. Carson had mentioned in a 2014 prayer breakfast, where he said, look, you give them the option to say, you put money in a health savings account, pre-tax, year after year, it accrues interest. You allow them to buy a catastrophic coverage plan to cover, God forbid something happens out of the blue. So catastrophic coverage, which is usually dirt cheap. And you put medical malpractice reform in place. So tort reform you put into place. So you do those parts of the equation.
You need that too.
Absolutely, because doctors a lot of times have to practice defensive medicine because you never know when you're going to be put on the court stand and say, hey, why didn't you look for this weird disease
That's
from...
why the malpractice is so high. Huh?
Correct. And why didn't you look for this weird disease from, New Guinea that you never thought you'd see in your life?
Forgot about that one, huh?
Yeah, exactly. So it's like, how can you possibly, we're not walking computers, we're humans.
Yeah.
So if you were to do that, and you'd say, okay, you now put back that freedom and choice. You get the insurance company out of the equation. You allow the health savings account to roll over year to year. You have the catastrophic plan, so if you didn't have enough money accrued yet, you could still have some way to bail yourself out if it happened too early in the plan. And as you accrued money, you could do it. And if you were too old and you got diagnosed with some horrible disease later in life, you could bequeath that money to your children, your grandchildren's health savings account.
Sure.
And if a child got born, you could open a health savings account, and instead of giving them a $100 savings
one
bond,
that you don't lose.
we
should point out that
one that you don't lose, one that rolls over
rolls
year to year.
over and is also heredity. You're able to transfer.
You could transfer it.
Yeah.
And some people, as Dr. Carson said, some people might say, what do you do about people that are too poor? Well, we already give money for their health care in the first place with Medicaid. We already had that safety net in place, and it was called Medicaid. We could give them the option and the choice and the freedom.
I never thought of it being there as a safety net already, but yeah, right.
Yeah, it was already in existence for people that were too poor. So give them the option to then say, hey, look, we're giving you money for Medicaid. Instead of that money for Medicaid, we could put it in your health savings account instead. But you can't use it to borrow against to pay off a credit card or pay for a mortgage payment or anything else. It's only for health care. So like that, it would then take the insurance company out of the equation. It would take the government out of the equation. And it would put the choice between the freedom of choice to decide what to do between the doctor and the patient. The way it was originally intended, the way originally it was done.
It's a fantastic
idea.
And
it kept costs way down
back
then before the inventions of HMOs, insurance companies, and all this stuff.
Question on you, in your profession, is participating members and enrolled members. Can you go through a little bit of that? Is that in the...
for doctors, you mean?
Yes, for doctors.
Okay. So what do you do right now? So I talked about, how do you potentially address it for the future? But what do you do right now? You're like, well, I don't want the Secretary of HHS to decide for me. I'm not Medicare age. I don't get Medicare already, but I'm a younger person. What do I do? Well, you could have a few options. One, you could quote unquote fly naked, meaning have no health insurance whatsoever. Turn around and put that money in the health savings not a health savings account. Put it in a regular savings account in a bank. Allow it to accrue interest, and then if something happens to you, like let's say you get diagnosed with cancer, well, insurance companies can't deny you for pre-existing condition. You could sign up. You have to pay for your healthcare costs for 30 days, but once you sign up, they can't deny you, which is one of the reasons why the healthcare plan falls apart, the Affordable Care Act falls apart, is because as more people figure that out, it will become more and more unsustainable for traditional insurance plans to occur, and even the exchanges won't be able to handle it eventually because it's just going to be unsustainable for costs, so you'll need some way to control it. But that is something you could do today in 2015. I'm not advising it because I'd be advising breaking the law, but you could do that. And you'd have to pay the fine, but the fine isn't as much money as people think it is. $295 per individual.
It's a shame that we have to go through all that, though.
Right. So there's one option. Another option is you could sign up with MediShare or Liberty Share, or there's a few other companies that are similar to them, which are health sharing accounts or health savings accounts that are, or not health savings accounts, but health sharing accounts, where you could sign up for one of those organizations, one of those health sharing plans, and basically you have to be for MediShare you have to be Christian. Liberty Share, I don't remember.
Oh yeah, there's certain criteria.
Yeah, there were certain criteria. You couldn't use tobacco. Okay. They don't only cover conditions for up to 6 months, and after that you have to cover it yourself. For MediShare, for Liberty Share, they cover up to $1 million worth of cost, but that's it. For MediShare, they'll cover cancer and dialysis indefinitely.
Well, I was going to ask you about that. That was my next question regarding cancer and diabetes, things that are transitional, and we don't know the term. And how do you manage that as a doctor?
Well, are you talking as a doctor right now? I mean, as a doctor.
I mean, it's going to change for doctors handling it,
Yeah, basically what the idea is, if you accept Medicare, you accept the exchanges, you accept Medicaid, the government has the authority, and once the electronic healthcare system and health charting system is in place, the eventual goal is to have your diagnosis on your patient go to a real live time to Washington, D.C. database that will come back to your computer and tell you you have to do A, B, C, and in that order. And if you go out of order, or if you decide that D is the right thing to do for that patient, you're violating the Affordable Care Act, which means that then basically you're committing a felony because you're violating a federal statute. And you could lose your license at that point in time. If you go ahead and go along with it and do A, B, and C, even if you know D is the right thing to do for the patient, you're subject to medical malpractice suits by the family or by the patient, should the patient survive.
You know, as an individual, how do you manage all that? I mean, as an individual doctor running through all these courses of events,
The way that I manage it, I resign from Medicare. I am no longer accepting of Medicare, and I don't accept the exchanges. So the way to handle it is to remove yourself from the system. And that means that then patients that see me have to pay out of pocket. If they have Medicare.
Could that mean less income as a doctor business person?
Absolutely. It can mean that as well, but it means that I don't have to reconcile that with my own conscience. I don't have to violate the Hippocratic Oath. I do what's right for my patients. I give them the right advice. I shoot straight. I don't have to worry about whether the government tells me I must tell them A and that they have to do B and C, or I give them this diagnosis, I have to tell them A, B, and C in that order. I don't have to worry about that conscience
Which
violation.
is the Hippocratic Oath, designed for you to stay in that.
Correct, which is why Dr. Manuel was saying that that's the biggest hurdle. And that's the biggest hurdle for all socialized medicine in any country, is to then say, look, devoid what you can do, devoid yourself from the Hippocratic Oath, and no longer look what's good for the patient. Just do what the government tells you to do. And that's not something that in a free
That
America
doesn't sound well
that
anyway,
you want.
any
So
way you put it,
no
yeah.
matter what your political slants on different beliefs and what you believe in different views, hopefully all Americans could agree upon, or most Americans would agree upon, the fact that they actually do want choice. And the lie about if you like your doctor, you can keep your doctor. If you like your health care insurance,
And
you can
that
keep your
was a
health care
lie.
insurance, was a lie, because you can like your doctor and keep your doctor as long as your doctor is willing to do whatever the government says. That was the part
We have
of
2
the
minutes
statement
left. I
that
want to
missed.
add something to
Yeah, sure, sorry.
one particular thing with Jonathan Gruber. The reason why I want to mention him is he sold us all and made us appear stupid.
Yet another one of the
John Q.
authors.
Public is stupid.
Right, and which is the reason why the Supreme Court decision, I reckon people back to the Kuromatsu decision or the Dred Scott decision, which is even more famous, the Kuromatsu decision. But the Dred Scott decision being that the Supreme Court said that slaves had no rights and couldn't even file cases in a federal court because
Wow.
they couldn't even be citizens.
There is an analogy there.
So there was a Supreme Court decision that was clearly wrong and a violation of everything we believe as Americans, but a decision that was made by the Supreme Court. Here a decision was made to say, hey look, you know what? The state no longer means state, it means whatever we want it to mean in order to help uphold the Affordable Care Act. And Jonathan Gruber even went out to say, before that case, he went out to say, look, we didn't want the states that didn't enact exchanges to get the benefits and to get the subsidies, because the people in those states shouldn't get the subsidies, because that would create political pressure to force the states to make the exchanges in the first place.
Listen, we did run out of time, and we did a good job trying to cover everything. I hope we got to everything. Thank you very much.
Sure, you're welcome. My
Dr.
pleasure.
Hassett. Societal and political trends are rapidly breaking down the family that once was the cornerstone of our great American culture. And FIT, we know you cannot get this information on your own. When did you ever see this before? And so we'll bring it to your TV every single week. And we always invite all opposing views. My name is Chris DiMaggio. Thank you for watching FIT TV, and we'll see you again next week.